Well, definitely living longer lives. So it doesn't make much sense to live a longer life unless you can enjoy full health and a fulfilling life experience. So we definitely believe that there is a case for prevention to stay healthy, to remain healthy, and also in terms of the sustainability of health systems, we need to keep patients away from secondary and tertiary care unless it's strictly necessary.
We need to develop a more sustainable healthcare system, and that's where I see the role of the community pharmacy.
Pharmacists are at the heart of communities. They're one of the most accessible and trusted healthcare professionals. You don't need to make an appointment to see a healthcare professional that is a pharmacist, and they're practically everywhere.
Well, pharmacists are the most accessible healthcare provider that's in the system, but they're also the most underutilized healthcare provider. And so by allowing pharmacists to practice to the top of their abilities, provides another knowledgeable healthcare provider as part of the healthcare team.
We have data indicating that pharmacists, for example, are taking an active role in administering vaccines and improving vaccination coverage in more than 27 countries currently. And there is data that this has not just been shifting patients from different providers of vaccines, but actually increasing vaccination coverage in those countries.
I think that the community pharmacy has a very important role in preventing these diseases, but also helping patients to stay healthy. I mean, it's self-care both for minor ailments, but it's also self-care when it comes to a long-term treatment for chronic diseases, for example. So it's a really important issue. We know that adherence to long-term therapy is about 50%. So here we have a great area for improvement. Globally, the possibility, opportunity for savings is about $500 billion per year. $500 billion per year. It's a really big figure.
Regulations need to be looked at that are causing barriers and artificial walls being placed on the abilities of the members of those teams to serve the needs of the patients. But then also we need to have incentives in the system that incentivize providers to want to provide the service and to be able to provide the service. So as we ask them to do more, if we're not also compensating them for those services, it's going to be harder for them to add additional services into their practice. My message for policymakers is to keep the patient at the center. If we all focus on meeting the needs of the patient, meeting the needs of healthcare, for them to live happier, healthier, and more productive lives, then providers will benefit and society will benefit.